Public Health in relation to falls? And what can you do in order to request additional data if needed? So I'm hoping to go over these 4 bullets: finding reliable data and navigating key data systems, explore ways to apply data to support programming, and learn how to interpret false data for community use. I am trying something different today. I'm hoping will be informative. Mia asked me to present it from a scenario perspective. And I thought that was interesting. And this is my scenario that I'm going to try to provide the data for this health system CEO. So I'm thinking you're a data analyst at a health system. The CEO has been receiving these quarterly report and showing that fall-related emergency room visits and inpatient stays has been increasing. And this CEO has realized that it is among group that is 65 years and older. And then there's another spike with work-related falls. So the CEO wanted to understand if they need to implement a fall prevention program within their health system, and how would that fall prevention program look like. So as a data analyst, you wanted to take your time and you wanted to see what are the available data that help the CEO in making a decision for their health system. So first of all, we really wanted to see if what the CEO is seeing in terms of adults 65 years and older is a true statement. So we really wanted to identify the population that is driving the burden. So the first thing with our Georgia Department of Public Health, you would want to go to our OASIS, and I am gonna need to get out and let's see, here it is. I wanted to see if you can see the OASIS webpage. Can someone let
we
me
can
know?
see it.
Okay. So I'm going to run my computer on the other side so I can see my slides and walk you through the department of through OASIS. How would you identify population at risk? So using our OASIS webpage is really very clear and very easy to navigate if you go through a quick training on how to use it. The data available on OASIS includes our death data, which is coming from mortality or vital record, our hospital discharge data and emergency room visits, which comes from facilities, hospitals within the state of Georgia that are required to report all their discharges to the Georgia Department of Public Health, but through the Georgia Hospital Association. So the data goes directly to the Georgia Hospital Association, and then it is transferred to the Department of Public Health on a weekly basis. So what we wanted to do first, we're going to look at the emergency room visit. So we wanted to click on there, and you would see on this, you have table, you have several options. You have tables, you have maps, and you can create kind of a quick dashboard of the leading causes of ER visits. But our first purpose is to really identify the population at highest need. So I'm going to look at the table, click on the table, and on the table, I'm going to increase my font a little bit. Hopefully you can see it better. You can see here we have ER visit, which would be the total number of ER visits. We would have ER visit rate. We have age adjusted rate, and then several other options. We have deduplicated ERs versus duplicated ERs. So the difference between those is that when you have a fall, a person might have a fall more than once. So they would go to the ER more than one time. So each event is counted as an ER visit. But you can do the total number of events as well as the total number of deduplicated, which is the person. So let's look at our total ER visits. We have the option to do it for the entire state of Georgia. We have the option to do it for rural versus non-rural and by the various counties in Georgia. We are able to do it for a long period of time as long as we had emergency room, which goes all the way back. You can go all the way back to 1999, but I feel the data is available for 2020, 2002 because of data reliability. Now, this has changed recently, and looks better, in my opinion. For causes, you can now scroll down and fall specifically for fall, it is under external causes because it's an injury. So I can scroll down and find fall right there and click on it, and I'm able now to just select falls related ER visits. So if I say I just want the total number of ER visits, I can just get the number, and here what we have for 2024, because that's what's selected, we have almost 189,000 ER visits or ER events related to falls. If I wanted to deduplicate to only find the number of people, that seems to be uh, got a little bit smaller, not very much, but a little bit smaller in numbers. So then I really wanted to know is what is the population that is at highest risk for fall. So I can do the ER visits. I can actually select the ages. So I can click on the less than 1 year and then hold my shift button and go all the way down and select all the age groups. It get highlighted, and then I can say get data. I wanted to stratify it so I can get it by age group. So now what I have ER visit rate by the various age groups. And you can see that it seems to be high for those that is less than 15 years of age. It goes down and then it start climbing up as you get to 65 years and older. So you can say, okay, but I don't want this data like this. I wanted to make it presented for my CEO to kind of demonstrate easily, visually, the burden of falls in Georgia. So I can actually save the data, and it will take you to Excel sheet. Can you see Excel sheet?
Yep, we see the Excel sheet.
All right, so you can now see that Excel sheet with the ER visit exactly as it was on the screen. You need to enable the editing so you are able to just quickly go through the data and easily present it, do the chart and easily present it in the way you want it. And here it is, you got quickly into a chart an easy chart that explains for you or show you visually how falls are age related. And you can see that falls tend to be high at a lower age group, and then it grows and it grows incredibly high at the age of 85 years and older. So this kind of a really, you have now able to uh, uh, pull this into a PowerPoint presentation or into slides or into a report to show the CEO. Yes, it seems that population 65 years and older are at higher risk for falls in Georgia. So I can close this one. I don't want to save it. I can go back to where I was. Now I know that my 65 years and older is at higher risk. Maybe I want to know more about that 65 years of age. So what I can do is I can check the age groups and then recheck only those who are 65 years and older by holding the shift, selecting an age, holding the shift bottom, and scrolling through in order to get all the age groups I am interested in. Then maybe I wanted to look at it by sex. I wanted to see if there is any difference between males and female. And I can just redo my age and sex. This seems to be very cumbersome. I do not like it in this fashion. I just wanted the age as one group. I can remove the stratify and then get the data again. And here I got the rate for males and females separately, and I can see that females tend to have a much higher rate of ER visits than males. Then maybe I wanted to, okay, maybe I wanted to look more at race, and I'm gonna go ahead and select the race similarly, select white, hold my shift bottom and go all the way to the end. I'm excluding the unknown race, and then do my and then get data. So now I have falls for those who are 65 years and older. It kept the age group that I am interested in and gave me the age group, that same age group uh, by race. I can add ethnicity if I want. I can add um, uh, payer if I am interested in knowing who is paying for these faults. So I am going to get back to do you see my presentation again? No?
No.
Okay. 1 second.
Mhm.
So here I went through my scenario. I went through how we go through OASIS and get our ER data. And here is our slide that is related to, I have, all right. So in here, I have for me, I have questions for you. Would you agree with me that this age group, 65 years and older, is the population that you wanted to focus on for your CEO? So if you would want to unmute yourself and let me know your thought, what else in this graph you would be interested and wanted to point out to your CEO?
Rana,
Yes?
I'll take a shot at this. Um, so yes, people over 65 are definitely at high risk for falls. However, I would also want to point out to my CEO, in fact, if the hospital also had children as patients, that 1 to 4 year olds have a higher incidence of ER visits than 65-year-olds do. So I think that's an important thing to point out to your CEO, especially if they also treat children.
Yeah. And what we wanted to make sure that we are talking about events and ER visits. So we're not talking about incidence or prevalence. These are just events.
Yeah, no, there's that's right. I said rate. I'm sorry.
That's
Um,
fine. This is fine. It is a rate, but these are events that is happening. And yes, you are definitely correct. If they have a hospital or a health system that is addressing children, that the age group may be less than 4 years of age needs an intervention, but that intervention would definitely be looking different than those 65 years and older. So I
definitely,
definitely
definitely.
agree.
Yeah.
And Rana, you have a couple of comments in the chat as well. So Gail mentions that our CEO would be very interested in the payer groups. And then
Mhm.
Liz also mentioned that there's something to see for the adult working class, 55 to 64.
Yes.
Um, and then and then we also have uh, can we see some of the severity of their injury?
Okay.
Yeah,
Excellent. Excellent. I bet you because you got some trauma people in the audience, and I am gonna go over the severity for these visits later in the presentations, if you allow me to hold that question till later.
and
So
beyond it, I
the
was
other,
going can you hear
go
me
ahead,
okay?
Crystal.
Yeah, beyond this, just being, at the age that I'm going to the doctor and I'm hearing all this degenerative stuff, you know, um, I also think, there's something to be said for realizing that in terms of fragility, we certainly want to message to that age group, but even getting ahead of that age group in regard to incidents, make sure that they're setting themselves up for success in older age. The messaging regarding fall prevention needs to be pushed earlier than even the incidence of fall prevention, if that makes sense.
Yes, so we need to implement our program early enough where people are aware some of the things that they need to do to protect themselves so they do not fall at the first place. Right, Crystal?
Right. Like I said, there's
Yes.
so
So
many.
yeah, you are all correct. And also, I will leave Lisa's question related to work-related falls till later because some of the things we wanted to identify are gaps in the data. And that is a very good question, Lisa. I do not want to ignore it, but I will come back to it. So another thing, like what I did is showed you how to do it by male, female, and I got the rate male and female. And what I could do from this data is that I can divide the male rate over the female rate over the male rate, and I can then say 59 for Georgia female residents 65 years and older, they are 59% more likely to visit the ER for falls related events than male. So now I can also say part of my burden is that more females tend to visit the ER than males, as well as when I did it by race group, I could say white residents, Georgia residents, 65 years and older are 75% more likely to visit the ER than their next in line African American population. So now I have identified my burden from three ways. I identified it from age, from sex, and from race. And yes, for the person who asked about the payer, I showed you how to select the payer. It's one of the boxes that you can actually select. And I did that. So when you do the 65 years and older and you select the payer, they tend to be all insured, Medicare, Medicare and private insurance, and very few uninsured, underinsured population, which makes sense because they're 65 years and older. All right. So again, the next question, if you remember, is this an increase? I'm gonna try to get this away from eyes. Is this an increase? And we can say, I went back and instead of selecting all the years, I selected 2010 to 2024. And I selected the group that the CEO was focused on, the 65 years and older. And I did it by sex to see if there are differences throughout the years, or is 2024 just unique, more female than males. So what you could see is that the trend was really stable from 2010 to about 2020, when we have this drop in falls, and we all know that was due to COVID. And then now we have been increasing slowly to the level of pre-COVID, and we have actually reached beyond pre-COVID level. So if you actually take the numbers for 2020, the rate for 2020, and you compare it to the rate for 2024, then you could see that there has been a 30% increase in falls related ER visits for Georgia residents. And I keep saying Georgia resident because on our OASIS, they've already selected only Georgia resident who went to only Georgia hospitals. All right. So there could be other Georgia residents that went to Alabama, went to Tennessee, went to Florida. We would not have this information on OASIS. It is not part of our required reporting for Georgia because the facilities are outside Georgia. And also there is a possibility where we have non-Georgia residents that participate in or visited a hospital in Georgia. Those are excluded because the denominator we have is the Georgia population. So in reality, this data is unique for Georgia residents who visited Georgia hospitals. Does that make sense? So that's one of the maybe deficiency in the data is that there is no national data set at this point to get all Georgia residents that visited the ER,
So
wherever it is.
if someone was looking at, like, let's say their own hospital data and then trying to compare it to Oasis, they would just have to understand some differences in what is available
Exactly.
in their hospital system versus what is publicly available.
Exactly. So when they are within their hospitals, and I actually have a bib example later. So if you are a trauma hospital, which is Navicent, Macon is a trauma hospital, and they see a lot of the trauma, they will see a lot of falls. So when they are going to do their analysis, they are going to restrict it for the Georgia resident in order to only have the Georgia resident. And the second piece, they're going to have to restrict it for those who are resident of Bibb County, unless they wanted to expand their county catchment area, and then they would have to select more than one county. And they really need to assess how much of that county they're able to service. Correct. That's very good, Jill. Thank you. Any other questions related to ER data?
Um, Crystal had a question for some of the people on the call. Have you used Oasis before? So for the people participating, have trauma folks, have you used Oasis before?
Do we have answers?
We have one. I was waiting for others to pop in.
It with their frequency, and I like it particularly for rural counties, that maybe you're not seeing the numbers, being able to maybe even look at contiguous counties, or or even you can look at your health district level to to be able to see what a regional trend would look like, and of course you'll have heat maps and everything else. But I also like it for things that we see are occurring in our communities, that are producing maybe high fatality rates, so not even the ER data, but your mortality data. That, for instance, suicides, they often don't survive to make it to our facility, so it's not being captured in our trauma registry data, but we're seeing it trend higher within some of our communities.
Sure.
And by and large, the answer to the question was no. So we do hope and that you'll be able to use it in the future. And then you have one more question. Trauma data is included in hospital data, yes?
Yes, and I will go over some of the trauma data. Yes. It is a subset of the the hospital discharge database. So it is included in here.
And this is by county of residence, correct? Not necessarily county of admission.
Of injury.
Is it county of injury?
It's county of residence, not necessarily county of injury.
So a different view too than what we may be associated with. So if we want to compare apples and apples, we'll need to make sure we understand the definitions too.
Yes. So that is a good point, and I am gonna go to the second piece of is not behaving as much as I would like it to behave. So I am going to the hospital discharge data again. And I'm going to Oasis again. And I always find it I'm going to the hospital discharges. So the ER data that we went through are events that happen within 24 hours. So they came in and they left the hospital before they made the 24 hours. The hospital discharge is considered our inpatient, correct? So these would be those who have stayed in the hospital more than 24 hours. What I also wanted to point out is that when you have any question about the data, we have definitions. Use these definitions to help you understand what is emergency room data, what is hospital discharge data, what are the parameters for that data collection. I feel it's very important that you refer to these definitions when you are in doubt of what is the data showing you. One of the things that is important to know is that maybe you want to do it by rural. There are so many definitions for rural. When I go to the definitions in the hospital discharge, I can scroll down. They are in alphabetical order. So this is what's non-rural. I want to go to what's rural. And this is what's rural. This is our rural definition. And it is based on the Georgia Code. And it is stated as any county with less than 50,000 in the population based on the census data, whether any census data, but started with 2010, is considered rural. So this is our Georgia definition for what is rural. It is different than what is the U.S. Census definition related to rural, urban, rural adjacent, and all these different definitions that you can find. All right. So here again, we are at the hospital discharge, and I wanted to make sure you are aware that this data only includes hospitals that are non-federal hospitals. So our VA hospitals and our DOD hospital, Georgia has 3 VA hospitals and 2 DOD hospitals. These are not included because these are federal hospitals and they are not required to follow the state laws. And that is also, if you click on the definition and you look at the discharge, you will have that as part of the definition. All right, so we have done
one more question in the chat, and it's sometimes ER patients are admitted to the observation unit and stay up to 48 hours, and it's not considered a hospital admission. Do we know how this population is handled in the data? Is it whether they were admitted, they become a hospital discharge, or if they are in the hospital for 24 hours and then they become a hospital discharge? Or is it some other definition?
Yeah, I don't think they are part of this. They are part of the inpatient. I would believe they're still part of the ER data.
Okay.
Right. And I just wanted to add that they are there more than 24 hours. That was part of the point. And we at Emory and probably many of the hospitals do have those units. So thank you.
So the next one is I wanted to kind of dig more. Someone was talking about hotspots, but you could do it with the ER, but I want to switch to the hospital discharge data. And in here with the hospital discharge, instead of looking at the table, I am going to hit map, and it's available in whether you are in the ER, whether you select ER, whether you select mortality, or whether you select hospital discharge or discharges. So I'm going to look at the discharges. and I am going to change it to discharge rate. If you did the age adjusted rate, you will not be able to select the age group that you wanted. It is not an option. If you see age doesn't become an option to select your 65 years and older. But if you kept it at the crude rate, then you have this age option where you can select your 65 years and older. As we said, you click on one, you hold your shift, and you find your last, and here you have now 65 years and older. Now you can do the rate by county, by public health districts, and if you are in maternal child health, then perinatal region will be important. But these would be the options, county and public health district, when we are doing discharge rate. So we are looking at 1 year aggregate 2024. And we are, again, we have to select from our external causes, we have to select falls. And let's say we're going to keep it as is. I mean, someone asked, can we do it, look at it by payers? Yes. See, you can also map it by the payers that you would like to select. Maybe you want to just look at Medicare payers, or maybe you want to look at a couple of them. But let's keep it this way. And you can select how you want to look at it. You want to look at broken into 4 groups, or you want to look at broken into 5 groups. So quintile is 5. You can do 5, 4, 3, and 2. Let's keep it at 5. Let's change the color. You can select the colors and you can map it. So here now we have our map for 1 year for those who are 65 years and older by county, right? And I want to point out this is Bibb County, all right? I mean, you can add the county labels. It's too messy. And here is Bibb County. But this is Bibb County, and I want to show you a couple of things. So let's say, oh, it seems like we have some holes. These white color, it says not reportable. It is not reportable. It's that they did not have enough numbers where we can do a rate. So they didn't have 10 in the cell where they 10 incident or 10 inpatient visits where they can produce a rate. So what I'm gonna do 5 years. They have actually given you an easy way to do it by just selecting 5 years. And here is the most recent 5 years, and I'm gonna rerun it. It's very simple, very quick. And here again, Bibb County still seems to have a lot or higher than other counties in terms of discharges for falls for 65 years and older. All right. So now you said, okay, I want to focus on Bibb. Maybe my CEO, I am in Navicent Health System, and I want to look at Bibb County. Maybe now I want to dig more in detail. So now I want to change my discharge rate to a number. So now I have a number of discharges. And now I want to change my county to census. So now I can look at the very smallest group. All right. And since I want to focus on Bibb, I can say I only want Bibb. And here we go. I'm gonna rerun the analysis. All right. So here now I quickly was able to map the number of falls for those 65 years and older by census tract, which is the smallest unit that I can get, in each census based on the census data, you could have a population somewhere between 2,000 to 8,000. So this is a much smaller community where I can intervene. And I can see this area, this area, this area, and this area seems to have the highest falls for those 65 years and older. Questions? What do you want to know more on this? I cannot see anything, Jill. If you don't mind, read it, or if someone unmute themselves.
Yeah, this is so extremely helpful, especially when we have, this is extremely helpful when we have overlapping service areas to be able to know where to target our education, because people may go to this hospital one week, but show up at another hospital the very next week, for preference purposes, for wait time purposes, or just how they're traveling. Very, very helpful.
I'm wondering if you are able to click on zip codes, which is on the left panel. Yeah.
Here it is.
Okay, so it does give you the zip codes for each of the.
It gives you the zip code and it gives you the census within the zip code. Yes.
Great, thank you.
You're welcome. And you can use your plus button. Let's say you want to focus on this area. You can use your plus button, bring it down with your hand, keep pressing the press button till you see what is the actual zip code in those areas.
So, Rana, I have a question. So what happens if you add in like the SES status on the side?
All right, we're ready to add SES. All right, I'm gonna remove the zip. We have the county. I'm gonna add SES. Here is the SES. So it overlaid the SES on your falls, right? So the darkest color is where you have the highest vulnerability. So this is your highest vulnerability in the county. And if you want to know what is it, what is the where we came up with the social vulnerability index, you can definitely go to the definitions and you can go to the social vulnerability, socioeconomic vulnerability, and you can see the definitions, how it was calculated, and the various definition that is needed for you to understand it. All right, I want to go back to my map. Here we go. So then this is, if you remember, this was the area where it had the highest falls, right? Do you remember? I mean, the problem is the sliding scale is not very good. If you take it this way, this is the lowest. This will end up to be the lowest vulnerability, means people are better off. And this area is the highest vulnerability. And when we go this way, this ends to be the highest falls. And this area where there is the highest vulnerability had the low number of falls. So for falls, and this is 65 years and older, right? This is 65 years and older. And for falls, the area where have the highest falls is not in an area where it is the highest vulnerability. So this is more falls, this is more social vulnerability, and this is more the middle. Make sense? Questions? Jill, I cannot see anything.
Yeah, so Crystal responded, this translates often to who will be able to access programming or translate education to action. Crystal, do you mind expanding a little bit about that? Because I think that's an important point.
And I'm sorry if I see she's having to lean forward when I talk. So are you hearing me okay?
Your voice is very low, but that's
Yes.
okay. I can lean forward.
For instance, who may need to carpool? We kind of had a standing arrangement with one of the last events that we did with our senior centers that they would help people that indicated that they couldn't get to an event because of transportation needs, or perhaps they need grab bars in homes, or they need assistive devices. Those would be the people that might not have the means to acquire those items, or they might not have a support system to help them install them. So this is often maybe an opportunity to partner with your local fire department, or we actually have a couple EMS agencies here in our region that actually will go out and help meet those needs sometimes. But that's why, to me, social vulnerability kind of translates to who's going to have the support structure to one, be able to get there and participate in the things that you're doing, and then two, translate what they're learning into something that has
Right,
utility for them.
right, right. If we changed our age group, the social vulnerability might not change, but it could be that at a younger age group, the falls looks different. I just focused on older adult at this point, but you can definitely change it and see how easy it is to change and move from one issue, one measure over other measures.
Um, and
One
Rana, I
thing,
missed a question in your, how do you download these maps?
um, okay, can I show you one thing and then we'll download it?
Yeah.
Okay, so this just to kind of talk back, remind you that this is the area with the highest number of falls for 65 years and older. This is one of the highest. This is one of the highest. Now I've seen a lot of hospitals that participating. I have a list of all hospitals in the state of Georgia. I can overlay my hospitals. All right. Guess where is the trauma hospital? Which of these hospitals? They're like 1, 2, 3, 4, 5, 6, 7 hospitals. The hospitals here are in a low fall area. If you want to consider the number of falls for the 65 years and older uh, is less than 17, while here is somewhere between 75 and 123. So this is definitely where your older population is living. And I can show you how to get your denominator. But guess where Navicent is? Which is it this one, this one? Where would you think? Is it in the highest or the lowest? See, this is where Navicent is. So you can click on the hospital and you know where Navicent, where the hospital located. You have the address for the hospital. So Navicent is a trauma hospital, and their catchment area is all of these areas, I'm sure. But they, at this point, Navicent is located in a low fall area. So for me, this tells me for Navicent to have good outreach, maybe Navicent wants to work with these hospitals that are in the highest fall area, and that would be Piedmont-Macon North, that would be Navicent Rehab Hospital, that's their sister hospital, and this is a behavioral health hospital. So maybe their sister hospital and work with this hospital, Piedmont-Macon. Does that help in identifying places to work with? But this area, I would assume this is pretty far from Navicent. Maybe I can zoom in and find where is the closest hospital. There is no close hospital to this area, right? These are the neighboring counties. And the neighboring counties, this would be Crawford and this would be Monroe. So this is Monroe County Hospital, which is a small hospital, but there's nothing here. So this is when Crystal was saying finding an organization, a AAA region, AAA facility. Hopefully they are there that we can reach out for awareness and implementing strategies to decrease falls in that area.
And I
I do
know,
not know.
yeah, so I mean, I know a lot of the folks online, came to say some of our Matter of Balance train the trainers that we did out in the Macon Mall. That's more in that western end of our county so that it's more accessible. Or when we do our Matter of Balance courses, a lot of times we will do them at our rehabilitation hospital or our wellness center versus the downtown area. But I mean, if you go back and overlook the social vulnerabilities map, those areas where you're having the most falls, particularly the northern end, didn't have the most social vulnerabilities because a lot of our older retirees, are kind of migrating to the northern end of our community, I think, is
Yeah.
we're kind of seeing. They're kind of ending up in more affluent areas, or perhaps, people are planning senior communities in those more affluent areas that we partner with to do some of the programs like
Yeah.
Carl Place and stuff like that. They still fall, but it also just shows you that people are going to fall no matter what background or level that everybody falls. It's falls do not discriminate.
Very good. That's right. All right. So for the question is how to save this. And you work hard and you like this. This is the perfect map you want. So I can then save it, hit the save and print button, and it's gonna give me the map I like. And get out. So that all right. So then what I could do is I can copy the image and drop it in my presentation. This is where I dropped it. And this is where I dropped it. I actually did the screen share because I wanted to, this is my guide of how to click and choose, but you can just new slide and then you can paste. And I do not know why it didn't do that. We'll try it again. Maybe save image. You can save the image and then you can copy it. But you can definitely, sometimes it doesn't behave with me, but you can save it, you can put it on your hard drive and then plug it in your PowerPoint presentation, or you can download it. a hard time. Or for me, it makes it easy for me because I wanted to show everything. I do print screen and I take an image and I plug it on my PowerPoint presentation. All right. Any questions? Okay. The second thing I wanted to show you is that you are here in this screen and you wanted to do something else. So you can switch. You do not have to keep hitting back, 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 back. So you can switch your tool. You can switch your tool to wherever you want it to be from within your system. I can switch my tool and I can get to another back to the original screen. And what I wanted to show you is, you can create dashboard to further convince your CEO that fall is a leading cause, is burdensome in your community, has a high burden in your community. So I'm clicking on the dashboard. Let's see. When I look at the 5 years aggregate, it's going to always give you the least 5 years aggregate and you go up. But let me ask you this. If you want to show fall and you want to show fall for 65 years and older, what would you change on this screen? Any responses? Would you change this one? Would that help you? Let's say I am looking for hospital discharges. I can keep my 5-year aggregate. I can do it for rural, for Georgia, rural, non-rural. But then now here, I have the opportunity to select. All right. So I'm doing it all Georgia. I'm doing hospital charges. I wanted to create ranking the leading causes of discharges in Georgia. I can say get data. All right, the 5 years where fall sits for 65 years and older. It is the third leading cause of discharge in Georgia for the 65 years and older. We decided to focus on BIB. Here I am focusing only on BIB and getting where does fall sits for discharges. It is the fourth leading discharges for Bibb County. Maybe I want to do emergency room visits, see if it is still the fourth for Bibb County for 65 years and older. Fall becomes number 2. So we have falls is the second leading cause of emergency room visits for those are 65 years and older in Bibb County. It was the fourth. Maybe I want to look at all of them combined. Death, discharge, and ER. So now when I combine all the elements, falls becomes the second leading cause of death, discharge, and ER visits in Bibb County for those 65 years and older. And we have a total of 7,498 for that 5-year period. All right.
Rana, you have a request to see if you can, how do you use the health districts 5-1 and 5-2? And could you show how you would do that on this demo?
On this one?
Yeah.
Let's see if we have public health district. So 5-2 is North Central. So I am going to 5-2, which is North Central Macon. And we want to keep death, discharge, and ER. And here we go. Falls becomes the number one for that public health district. All right. For 5-1, which is South Central. So South Central then becomes, where's South Central? Here is South Central. Take me a while to find the one on top. And that is my South Central. Falls is also number one. And it is one of the highest because it's toward the highest on this, what is it, this speedometer.
Can you also do, let's say, Clark County and its area? I don't know which.
Clark County, that would be 10, or you want it as a public health district?
Yeah.
So that is District 10, and that is Northeast. So you can keep choosing the districts that you are interested in, and just a click, you're switching from one to another. And one thing I want to show you, okay, this is the Northeast. This is the 5-year. We selected 65 years and older. Someone said, maybe I'm interested in the young age group. So if I keep scrolling, I have it for the Northeast for all age groups. And here I could see for the person who asked about pediatric, falls is the second leading cause of death, discharges, and emergency room for Northeast Georgia. And that is where you're 65 years and older. This is where fall is the first and the second for 65 to 74, and falls is the first for 75 years and older. So it gives you more detail by age group. So you're kind of look at all your causes and where falls rank within your causes, right? And you can definitely save this image, but I don't want to do it because my computer is not helping me today. So if you forgive me, and I wanted to show you something else related to you can do trends if you don't want to like do it the way I did it, save it, put it in Excel. You can do your trend. Let's say you're looking at discharges. You want to look at 65 years and older. I'm going to do this quickly. And I want to look at, let's say, back to 2008. We want to look at it by male, female. We want to look at falls. And it's all Georgia. I can do rural, non-rural, but I can get quick trend. And here, if I don't want to fool with Excel, I can get a quick trend for the number of years I've selected. I can have it by male, female. I can select all. And I have the data right underneath if I decided to change the color or I didn't like the way this map looked like. So that's another service this Oasis help you do. Now what I would like to do is go back to the other data sources, because in reality, Oasis provide you with a lot of data that you can determine your burden.
As she's accessing her next data source, I'm getting some questions in my text messages. But just for everybody's clarity, um, this is open source information that's always been available to
Yes.
the Georgia public. That DPH is actually required by law to correct. So the ER data and the more and death data, there's a lot of different tools included in that. So yes, you can use it readily and publish it as you find it. Correct.
Yes. Yes, you can. And there is when you do your analysis, there is a way to cite the website
It's basically Georgia's version of the CDC's whiskers. Correct.
without the cost.
Right. Well, because we have people like y'all that are awesome.
All right. So I kind of just pulled all the information together and we like to show something like this. So I was able to do for our older adult ER hospitalization and death. You can get the numbers, the percent out of death, ER and discharges. But when I wanted to skip now to the trauma data, I know there are a lot of trauma coordinators on the call, so I want to address some of their questions. So this is our data from the trauma registry. This is our website for the trauma. And on this website, you can find the data dictionary, which is important to look at because it gives you the criteria for what is included in our trauma registry. Then we have reports that tells you the hospitals that participate in the trauma registry. We have a map available that can show you where the trauma hospitals are located. And I think in 2024, we have about 33 hospitals in the state of Georgia that are trauma registry. Why this is important? Because trauma fall is the leading cause of trauma in Georgia, and it is contributing to almost 53% of all trauma-related hospital visits. So what I did is, with all the falls, we had 23,881, while the hospital discharge, all discharges were 29,556. So almost 80% of our discharges are included in our trauma registry. So the coverage for trauma registry is about 80%. And for the trauma, the death is really low among falls. So for those falls with trauma-related falls, the death rate was about 2.6%. So again, if you look at the trauma registry, they have the trauma report, and I put the contact person to actually receive the report. This trauma report was on the web, but for some reason it is not there. But you can still get the report because it is approved. So the trauma data kind of mimic the hospital discharge data, right? We have younger than 5 years of age where the falls is really high, and then start climbing at about 55 years and older. And this is kind of what someone asked me, where we get this severity of these, and that is in the trauma registry. So because the trauma registry, the trauma coordinator actually look at every single one of these incidents and code it appropriately, you can get more information on these falls and the severity of these falls as they come into the hospitals. So technically, almost the majority of our falls tend to be minor or moderate with an ISS score between 1 and 15, and about 11% tend to be severe and very severe. And you can see the as severity increases, mortality increases. So those with a very severe injury, almost 21% die by the time they are discharged. So if you want to use the trauma data for fall, you can contact, if you want it from the report, you can contact Dan Lynn. She can send you the report. But if you want to do more analysis, you need to request the data using our FIP. And I have a direction on how to do that.
Rana, can you scroll back a couple of pages so that we can catch that website again? Right there.
And these slides will be shared, right?
Yes, we are happy to share the slides.
Yeah, you can share. I can share the slides. You don't have to take notes, and I have the QR codes that can help you. The other data source that we have is the Georgia Behavioral Risk Factor Surveillance System. And we had falls for a few years, 2023 and 2026. The BRFS is a telephone survey where we ask people, call them on the phone and ask them questions related to their health behaviors. It is a CDC, it's a collaborative with CDC. And the fall is part of the core questions, and it is rotated every 3 years. So that's why you see it in 2020, 2023, and it is currently run in 2026, and then later will be in 2030. The two questions asked is, in the past 12 months, how many times have you fallen? And it gives you a number, and this is what called a prevalence. So those people who had experienced any type of falls. And then the next question asks, how many of these falls caused injury where you had to go to a doctor? So it gives you severity. CDC makes this data available for everyone on this website. And for us in Georgia, you really want to contact Dr. Mogus Idu because we didn't do a lot of analysis on it. So if you needed more specific analysis, you really needed to contact Mogus. I was going to show you how to use the website, but I think we are limited in time, right? How are we doing on time, Joe?
We have about 10 minutes left.
Yeah. So maybe next time, or maybe if you want to give me a call, I can walk you through how to go on this website because it's not easily spotted on how to do it on the CDC website. You don't have to actually go on that prevalence. You actually need to go to the web-enabled analysis tool and do more analysis to be able to get to falls and do the analysis. But from our BRFS, I asked our coordinator, Dr. Mogus Idu, to give me a quick look of how, number of people who are falling on a yearly basis. And this is for 45 years and older. That's the questions is only asked for those 45 years and older. So almost a quarter of our population do fall on a yearly basis and have more than one fall. And from these falls, 9.6% tend to lead to an injury that requires medical attention. All right. And that's all what we did with this. I was going to
Within context, then, Rana, the other 90% of falls would never make it to a hospital
Yeah,
system for their reporting. So,
correct.
like
So the
OASIS data would be like the tip of the iceberg of how many people are falling underneath of that iceberg.
right. That is very correct, Jill. Thank you for explanation. I was running through my slides. I do apologize. But we had a good engagement, so thank you for asking all these good questions, and I hope this you will actually walk through the slides again and do the activities on the slide. This is another new database that we have that is called All Payers Claim Data. And it is part of the Georgia GTA. When you go on the website, you would have this video uh, explaining what is all payers. So technically, data coming from Medicaid, Medicare, private insurances. I think they cited almost 90% of payers have shared their data on this website. Also, it gives you a mechanism on how to request this data and how to analyze the data. So one of the things that I found that is important for this group that is not easily accessible on the Oasis in order for you to do some of the consequences of falls, um, you, uh, you would need to request the data from Oasis in order to do your own analysis. But on the all payer, you have the choice of selecting hip and pelvic fracture. And you can select the county, you can select the year and the sex and the age, and you get a map where it shows you, where you have the highest falls in the state of Georgia. And here in this bar chart underneath, it kind of shows you definitely that those who are 65 years and older tends to have the highest falls. And what's the beauty of this one is gives you a cost, which we do not have on our hospital dish on Oasis. So it gives you the medical cost. And if you actually click on the medical costs, I was going to show you, you will get detail on this cost. So it gives you here like the average cost is 54,489 for a total cost, but the direct medical cost is 6,525. So it is expensive. And you can go to Bibb County, which is right there, and you can do that same exact analysis for Bibb County. And this is Whiskers. I'm going to let you guys play with Whiskers. I have enough. I think I have the slides of how you lead to the leading causes of falls and the cost for falls in the state of Georgia. Any other questions in terms of data? So how to request this data for OASIS data and for the trauma data and for the BRFS data, the DPH data. We have our FIP data request, and that's the website, and you would actually click on the FIP. You will come to this page where you would want to do the FIP data request. You can do a FIP data request. You will come to this page, and from this page, you definitely complete this. But when you say assign to program, you want to to select either epidemiology, OHIP for the OASIS data, the BRFS data, And for trauma, you want to select EMS. Even though you did not select EMS, you select epidemiology, we can send it back to EMS. So no problem if you made a mistake, we can always correct it from our side. So you would complete this data request, and in there is a place to upload a document. And what the document you needed to upload is your IRB. We have another website that is called the IRB. And in the IRB, if you scroll down, we have actually, let me go do it because I missed the slide. So this is our IRB. If you scroll down, you have initial application. You would complete the application, sign it, and send it to us. It could tell you that you have a payment, but don't be afraid of the payment, because the payment would be waived if you said that you really do not have uh, uh, it is not part of a grant or a research, then this payment structure doesn't apply to you. So don't be afraid to apply if it says there is a cost to it.
So Rana, what if one of our programs just wanted to kind of get a little bit more information, but they're not necessarily doing research or needing to go through the institutional review board? How do they reach you then? Like, is that another option?
So throughout my presentation, I don't know if you know, well, we didn't go through my actual slide because they were guidance, but I put the contact. So this is, if you wanted to do BRFS, contact MOGAS. If you wanted to look at the trauma, you would contact Dan Lin. And of course, you can contact me at any time because they're part of this. The Dan Lin and MOGAS are part of my section. So you can contact me and I can refer you or I can guide you.
Thank you, Rana. I think we have time for one more question if people have anything that they'd like to ask. And I think Mia has an evaluation survey. If you guys could help complete that, that would be really informative for us in terms of how this went, any adjustments, and additional information that would be helpful for you.
I just really appreciate the work y'all do, and just for I guess to be transparent, we did not work on this ahead of time. I did not know she was going to be doing Bibb County, everybody, but I'm glad she did.
I knew Navicent is there and you're a good hospital, so.
And
Well, and I think it demonstrates too. I mean, we're a hospital, but I mean, we're a multi-hospital region, and we're even a multi-hospital county. So, I mean, I would say the trauma, just like you said, the emergency department visits and are only a percentage of the tip of the iceberg. The trauma registry data really is only a tip of that tip, because
That
you
is
have to
very
be
true.
severe enough to make it. So to me, we for ACS, we have to use our trauma registry data to determine our priorities, but to target our interventions, I really feel like the OASIS data is more helpful, if that makes sense. We just have to remember the OASIS data isn't going to be as current as we have in our own trauma registries.
Yes, it is. You are definitely correct. The up-to-date data is 2024 now, and in August of the following year, so in August of 2026, you'll have 2025. That is absolutely correct, Crystal.
I know we're at time. Rana, I just want to give you a really big thank you. This was incredible. Crystal, I appreciate all of your commentary today and on giving context to all of the data and putting it in terms of how you use this in your program. To everyone else on the call, thank you so much for your participation and your engagement with both the content and kind of everything that was presented. I feel like every time I listen to you, Rana, talk about Oasis, I learned so much more than I knew at the prior discussion, and want to go back in and play around with all of the data in terms of how we can use it better.
Yes.
And
Yeah, I mean, Oasis is really good tool for doing a lot of things. I mean, the basic descriptive, you can run all your grant writing based on Oasis. And then when you wanted to do more detail, then that's what you would want to request additional data from FIP and or do an IRB. But for the general and for your basic information need assessment, Oasis is more than enough. It's very rich tool.
and
Yeah, I think
thank you.
this was very, very helpful. And I mean, I've used Oasis for a long time, but there's definitely things within Oasis that you taught me today that I didn't realize that was there. And I know that you provided many, many other tools that I'm anxious to kind of dig into. Um, so um, and being an epidemiologist, if you could hold the line a little bit, I'd like to just show you some. I only have like two or three slides that maybe show you and ask you if I'm framing information in the right way sometimes. But that's
I
up.
actually